Hi guys, I just wanted to clear up something about this whole vitamin D COVID-19 situation that has been confusing some people. I just wanted to make sure that you really understood exactly what the whole relationship between the two things mean. So as you might have seen coming out a little bit in the medical literature, which I've been trying to push out there and tell you guys about, there's a lot of researchers are finding this relationship between low levels of vitamin D, so vitamin D deficiency, and increased risk of like bad things happening for people who get the COVID-19 virus, and also up to and including death. So get putting on a ventilator, getting really bad respiratory symptoms, etc. The whole thing about the COVID-19 virus is that really it's about a lot of people are getting the virus and having no symptoms, but obviously there's a small portion of people who are becoming really, really sick. And what we're seeming to find at the moment is that with this virus, in some people, it's activating their immune system, like making it more overactive and causing a higher, what we call an inflammatory response. So higher levels of your body's immune system going too active, becoming too active, and not only trying to attack the virus, but also trying to attack different bits of the body and making people really, really sick, and they end up on ventilators and all that sort of stuff. So that is what appears to be occurring in some people. Now, the relationship between vitamin D and COVID-19, just think of it this way. Vitamin D is not a cure for COVID-19. And a lot of people are trying to say that. They're putting it the headline, is vitamin D a cure for COVID-19? Well, no, it isn't. There is no cure for COVID-19 at the moment that we've found. Medication-wise, vaccine-wise, that's still months and months away from being a possibility. So there is no cure for COVID-19. The best things that we can do, of course, are to prevent the transmission of the virus between people, to stop us passing it on and hoping it just sort of dies out that way, or at least minimise the spread, and also to make sure that our immune systems are well supported so that they don't become overactive if we do get the virus and we don't have these bad things happen to us and putting us on ventilators. And unfortunately, a lot of people are passing away from this particular highly infectious virus. Now, the role of vitamin D plays is basically, think of vitamin D as, a lot of people just think of it as to do with their bone health. Now we know with the research that vitamin D is much, much more than just looking after bones and calcium. Vitamin D is basically the puppet master of your immune system. So it helps to control how your immune system responds to something, be that an injury or some sort of infection. So it's really, really crucial. And what we're also finding is that all of the studies that are coming out is that most people, the majority of people in our communities, are vitamin D deficient. So we don't have enough levels of vitamin D. So basically what that means is if you don't have enough levels of vitamin D in your blood, then the ability of your immune system to respond appropriately to an infection is greatly reduced. And that puts you at an increased risk for complications from COVID-19. So having good levels of vitamin D is crucial to help your immune system control your response to the virus and the attack, and make sure it's mounted correctly. But it's not going to stop you from getting it, and it's not going to stop you from passing it on. All we're looking to do with vitamin D is to ensure that we've got adequate levels there in our bloodstream and in our bodies to help control the immune system and make sure it doesn't send it into that hyper active or inflammatory state that's causing a lot of these people dying, unfortunately. So that's really the key benefit from vitamin D, is what we're seeing in the research now. And really the bare minimum in the studies that are looking at vitamin D seems to be most effective around the 75 or higher mark in the blood. That's seeming to greatly reduce the risk of those bad complications happening from COVID-19. So vitamin D, it's not going to stop you getting COVID-19. It's not going to stop you transmitting COVID-19, but it will certainly control the way that your body responds to it much better and greatly reduce your risk of complications from COVID-19. So as usual, if you've got any questions on this, or if you want to ask us more data or whatever, please send us a message or pass this on to other people. There's plenty of research now that just starting to emerge about this link between vitamin D and COVID-19, and that is what it is. And if people, the other question, of course, naturally, should I be supplementing with vitamin D? Well, the first thing you need to know, of course, is your level of vitamin D. If you're deficient, then you should be looking at supplementing. If you've got enough of it, then really having extra vitamin D doesn't appear to be a huge benefit there. Okay? Thanks very much for listening, and have a safe and good day. Thanks, guys.